Hi, today I will be introducing you to Kami Health, an AI-powered platform for smart policy and targeted health promotion, leveraging graph theory and language models to transform healthcare insights. And it's to be demonstrated by me, Martin Rodriguez. So let's get into it. So let's look at first into the introduction for Kami Health. This is our graphical representation of what Kami aims to do both at the front end and the back end. First and foremost, we gather data from our healthcare data partners, food, mental health, and accident providers of data. Then we generate a graphical neural network. And with extracting of entities and relationships from these data, we're able to create a knowledge graph based on several features based on how similar relationships are. And after this, we basically fuse these features together to basically create a knowledge graph containing information and similar relationships to each entity. After this, we create a graphical representation of the learning that the neural network was able to understand and make a prediction model based on this. This is an example of the result of an already existing technology, somewhat different though. This is Obsidian, a note-taking platform. We aim to be very similar, but in the healthcare industry. This is an example of the front end based on user input using a large language model for the graphical neural network to explain basically what the relationships between entities are. And with all this being done, we're able to create and explain efficiently the graphical neural network's prediction between examples of healthcare, risks such as chronic disease, hospital readmission rates, and impact of interventions. So what does this look like from a customer standpoint? You, the user, such as a researcher or policymaker, register and make an account with us, Kami. After this, you're able to prompt/chat with our software, and we'll be able to bring you to the exact same conclusions very seamlessly and without any of the back-end knowledge having to be understood directly by the user or the customer. Now let's kind of explain why this is essential and really a big opportunity. But first and foremost, you have to understand graph theory. Some of the basics of graph theory include the mathematical structures of how this even works. Using nodes and connections, entities, and relationships, we're able to efficiently model relationships between aspects such as healthcare, such as smoking and car accidents, things that may not seem very similar uh, at first sight, but maybe lead into valuable insights with the use of technology such as Kami. Application and health data analysis. Graph theory basically allows us to understand data analysis on a healthcare front. Such analysis has been used before, basically tracking diet and exercise and other related fields, and this will be the same on those fronts as well. Visualizing relationships with graphs. Very similar to Obsidian, we aim to make the clear visual representation to our customers about our relationships and entities as seamless as possible in order to create strikingly visual and easy to comprehend aspects for anybody. Now let's look at the LLM's use in healthcare, which we aim to be a part of. LLMs, first and foremost, basically generate human-like text, allowing for complex understanding of anything from complex medical languages to learning a new programming language to understanding and planning dates for a new trip. We aim to use this technology to basically efficiently explain the graphical neural network's results to our customers and to ourselves as well. The role of large language models in analyzing healthcare trends will be very large. Because of the huge amount of data being used, we need an efficient way to explain that to anybody. So using a large language model to process, patient data clinical notes, and research papers in a safe, ethical, but efficient way is our number one priority and something that we're already pretty proficient at already at. And specific use and case study of practical engagement of an LLM application based on MedRxiv. LLMs have already been used on social media before, such as X to predict disease outbreaks, and as stated in the article, diseases such as Lyme disease were able to be tracked more efficiently with the use of large language models processing data through Twitter. And lastly, integrating graphical neural networks and large language models for insights on both customer and healthcare trends. Based on what I said previously, graphical neural networks aim to design and create graph-structured data and understanding complex relationships among very different variables in healthcare. In this case, this will basically help us understand and create the models that we wish to use for researchers and for customers in general. As stated previously, some correlating life factors that may not, initially seem very similar could be understood more efficiently, such as risk of developing long-term, birth defects of a mother in pregnancy, and how does that correlate with, some underlying or some disease that she may have been documented with. So, for example, diabetes. How does that affect pregnancy? How does increased health issues affect pregnancy? And that's just one case that may be applicable in this case. The future of AI and in targeted health promotion. Graphical neural networks, large language models are already being used in a variety of different industries. We just plan to use it in a health promotion in this case to identify and truly help populations at risk and to aid both medical workers and their customers slash basic people, everyday people, and getting the treatment that they deserve and that they need based on improving new technologies, which is Kami is aiming to do. So that brings me to my last question. Why Kami Health? Incorporating graphical neural networks and large language model into healthcare truly does present a transformative opportunity for the understanding of health dynamics and analytics. As a stakeholder, having an early opportunity to invest in these technologies and to truly harness their potential for improving health outcomes, suggesting shifts in policy and practice based on data-driven insights is a very rare opportunity. And with all that being said, on to one, thank you, and two, look forward to the next time we are in touch. Thank you.